So I'm glad that you're here. Bob will be explaining the whole process for your information. And without much ado, I'd like to introduce Bob over here, Bob Warner from Garden. Thank you.
How you doing, guys? Hi, everybody. Thanks for having me today. Pleasure to be here and see your smiling faces. So is this your first semester at Centennial? Awesome. So if you're excited about being at Centennial and in Canada for the first time, let's hear a round of applause, shall we? Woo! All right, thank you very much. Thank you. All right, so I'd like to do a few things today. I'd like to talk a little bit about staying healthy and safe in Canada. I'd like to talk about why you need an emergency medical healthcare plan in Canada. It's very important. I'd like to talk a little bit about your coverage, things that we cover, things that we don't cover. And if you do get sick, how to access healthcare, the different kinds of healthcare that we have here, and also how to make a claim in the event that you need to make a claim. Okay? So staying healthy and safe in Canada can be very easy. And easy is an acronym. So what does an acronym mean? Anybody?
Different words, and you just take the first letter out of it.
Awesome. Can you give him a prize, Donna?
Prize?
Thank you very much. See, there's prizes too. There's prizes.
It doesn't hurt to have double.
I should mention that if you're listening on video, there's a little Q&A button on the right-hand side of your screen, and you can enter questions now. Okay. And if you guys have questions, we'll probably leave them to the end if that's okay. All right. So staying healthy and safe in Canada can be very easy. And what do you think E stands for in easy?
Easy.
What do you think E stands for? And you have a
Expensive.
expensive. That's one thing in Canada. It can be expensive. Eating. Excellent. Good. So how should we eat? We should eat well, right? What about A? And you're cued by the little picture of the two hearts running.
Aerobics.
Aerobics, nice one, sure, why not? Activity, right? We need to get plenty of activity. And S, what do we think S stands for?
Sleep.
Sleep. Sleep is very important. And how about Y? What do you think Y stands for? A little difficult, no Q? U. So it's up to you, right? All of these things are your choice. So I actually taught in Korea for about 10 years. And when I was there, we would have students that would go to Canada or Australia or the USA or different countries to learn English or study and come back. And they would say to me, you know, Bob, food in Canada is very fattening. And I'd say, really? Why do you think that? And they said, well, you know, they've only got, you know, there was a McDonald's right by my school and I gained 10 pounds. And I'd say, okay, well, if you eat McDonald's every day, you're going to gain weight. And they'd say, no. Not every day. Some days I would have Wendy's, some days Burger King, some days KFC. So the key to eating well is really getting variety, right? And as you can see by the picture, our supermarkets have lots of fresh fruits and vegetables. We have lots of meats and dairy products and probably some spices and things from wherever you're from in the world too, right? So we have a lot of variety. Our restaurants, we have restaurants from all over the world. So we're not hurting for choice here. We're going to have some pizza today, which is also fast food. But the key, as I mentioned, is just not eating fast food too often, right? Not eating it every day. How can we stay? Oh, what is this thing? It's an expiry date. Excellent. And why is an expiry date important? Yeah, to make sure it's fresh. So after the expiry date, we just you're going to be rich with swag, my friend. So after the expiry date, you can share. After the expiry date, we shouldn't consume the food, right? So you can check it before you buy it at the store and also before you pull it out of your fridge as well. How can we stay active? What are some ways? Exercise, good. What are some good exercises?
Cricket.
Right?
I play cricket.
cricket, awesome. Hey, I don't hear that
A
often.
sport would be good.
A sport?
On a regular basis, probably a jog or else a walk for a mile. Or else at least to get your groceries, you can walk down the street and come back again. That's more than enough.
For sure, yeah. Choose to walk instead of taking the bus
Taking the bus
sometimes
or
or driving, yeah. And sports, I love the suggestion of sports because it does a couple of things. You get the social aspect, you get the physical aspect, you get support from other people. So it really helps you cope with, what is it called when you move to a new country and you have the stress that's associated with that? Adaptation issues, but culture, have you heard of this?
Everything.
Culture. Anybody at home? Somebody's whispering. Culture shock. Culture shock. So things like that really help mitigate or lessen culture shock, right? So great suggestions. What is this guy doing? Sleeping, taking a nap. How much sleep should we get in a night?
7 hours, 7 to 8 hours.
7 hours, 8 hours. Some people need 6 hours. The key here, consistency, right? Not 12 hours one night, no sleep the next night, right? But just consistent sleep. And get a good pillow. This pillow, not so hot. All right, so this is what your GuardMe health card looks like. If you don't have it now, do you have it? Do you have your card now?
We just got an email about the policy number.
Excellent. Okay, great. So if you don't have it now, which you don't, then you'll be getting it shortly. The international office will help you with that. But you are covered now. Most of you have been covered from May 1st. Now I want to talk a little bit, hi guys, newcomers. How are you? My name's Bob. I want to talk a little bit about why you need a comprehensive emergency healthcare plan. This was very important to Centennial, and they partnered with us to bring you the best plan that they could for the best price. Healthcare in Canada is incredibly expensive. So these are some examples of some of the prices, some of the costs of healthcare in Canada. Visit to a doctor or a specialist, anywhere from $60 to $300 on average. An ambulance can cost $250 in Toronto, $900 in Halifax, whether you're going 30 minutes away or 1 minute away. Okay. Emergency room will cost at least $500. Overnight stay in the hospital, $2,000, $3,000, $4,000. A broken arm can cost $3,000 or more, depending on what needs to be done. And appendix surgery, we've actually paid over $16,000 for appendix surgery. So somebody has to pay the costs. And if you don't have insurance in Canada, you pay the cost yourself. If you have insurance, then as long as you are eligible for the treatment, the insurance company pays the costs. Okay. This is what the appendix looks like. I mentioned appendicitis, very small organ. But if it gets sick and inflamed, you'll know it's there. And it's very important to get it treated. All right, so I want to talk a little bit about your GuardMe plan. We pay 100% through your policy, 100% of eligible charges. So that means we have no deductible and no copayment. Can somebody tell me what a deductible is? Some insurance plans have a deductible.
I will not pay the entire amount, 25% or 15% be covered by you, and the remaining 85 or 75 or 60% is covered by the company.
Well, a deductible usually, what does deduct mean?
Deduct is negative, that's minus the stuff.
Yeah, right. So the insurance company would take off a certain amount of money, usually the first couple of claims or something. They would take off the amount owing, right? So that you would be responsible for part of it. And how about co-payment? What does co mean?
Together, you pay half, I pay half.
Together, great, yeah. So co-payment, you share with the insurance company, right? We have none of that. So we pay 100% of eligible charges, but it's very important to know what an eligible charge is, right? So basically, it's anything that's new or emergent. And that means that any condition for which medical treatment is necessary that begins after the policy start date, right? So Examples would be things like a stomach ache or a headache, or you fall down and break your arm, or you have the flu, or even very, very serious things like, knock on wood, this doesn't happen, but a heart attack or something like that. Things that we don't cover are pre-existing conditions, conditions that pre-existed that happened before the policy start date. And a good example of something like this is a chronic ongoing condition. So does anybody have an example of a chronic ongoing condition? You know what that might be? Asthma, great example. So with asthma, often people will have to take inhalers. What we don't cover is the cost of the regular maintenance of the chronic ongoing condition. So we wouldn't cover the cost of the puffer. Medications are usually covered up to a 30-day supply, but for a chronic ongoing condition, it's not covered. Okay. What is covered with a chronic ongoing condition is if you're doing everything that you should be doing to maintain a stable condition, to keep yourself healthy, and for some reason you get worse, right? You're following doctor's orders, but you get worse. We call that an exacerbation. And exacerbations are 100% covered for all treatments or medications required to bring you back to a condition of stability. And then once you're stable again, then the cost would be up to you. Does that make sense? Yeah? Okay, fantastic. So one more time, we pay, or under your plan, you're 100% eligible for coverage for hospital fees, x-rays, lab testing, etc. Okay. Now there's, for some things, there are limits in your plan. For example, paramedical practitioners. I know some of the student population likes to go and see acupuncturists or massage therapists. So these would be covered up to $500 per category. Now it's important to note that, you know, if you wake up one Saturday morning and you say, oh my gosh, it would be great to go for a hot stone massage today. You can go for a hot stone massage, but it won't be covered, okay? Because that would be considered sort of a relaxation treatment, right? But remember, the policy is for new and emergent conditions that are medically necessary that you get treatment for them. So if you wake up one morning and you go, oh, ooh, and you have pulled a muscle, that would be a reason to go to a massage therapist, for example. If you go to a massage therapist, we ask that you, or it's a good idea that you get medical notes from the practitioner at the time. Because our claims department, they're excellent, by the way, our claims department, they always look for reasons to honor the reimbursement rather than to deny. But they need to show that this is, or they need to be shown that this is for a new or emergent condition. Okay, so the practitioner, the massage therapist, or a chiropractor, or acupuncturist, or whoever it is, will be able to communicate whether or not it's a new or emergent condition. Okay, does that make sense? Yeah. If you don't provide those medical notes, it is possible that the claim might be returned, and our claims department would say, please provide these medical notes. If you have to get them afterwards, the practitioner may charge you. Okay, so it's always a good idea to get them at the time. Make sense? Yeah, okay, great. You're covered worldwide. So you're covered everywhere in the world except for your home country. If you finish a semester and you want to go to anywhere else in Canada, you're free to do that, and you have full coverage. If you want to go anywhere else in the world, you're free to do that. But again, in your home country, there's no coverage under this plan, okay? I've talked about a few different benefits, but you have a lot more benefits. So read your benefit summary. We can talk about some of these after the presentation, if you like. But read your benefit summary so that you know what you have, okay? Oh, something else that I should mention too. If you are in a course that requires, usually we don't cover immunizations under this policy unless it's course required, okay? So we offer up to $100 for course-required immunizations, things like a hepatitis shot. Okay, so those would be courses like nursing or ECE, social work. Okay. It's also important to know that your dependents are not automatically covered. So if you would like to have dependents covered, your spouse or children, please talk to the international department. Donna Mapanao can help you with that, all right? So again, this is what your GuardMe health card looks like. I've circled the policy number. Policy number is very, very important. The policy number tells us exactly who you are. So we may have another Jasdeep Singh here, for example, but there's only one person with your policy number. So whenever you communicate with us, please let us know which policy number you have. Okay, so if you get sick or injured, where do you go? In your country, where would you go if you get, let's say you have a cold, where would you go?
Clinic.
A clinic, okay, great. Would anybody go to the hospital?
No, not really.
In your country? No? Okay. Some countries, it's just standard to go to the hospital for anything. Here in Canada, just as in your country, we don't go to the hospital if we have a minor illness, all right? So if we have a minor illness or injury, we fall down and hurt our hand maybe a little bit, we would go to the clinic. If you get into an accident or you have something major, you have a heart attack or something like that, you would go to the hospital. Where will you get better care? Well, at a clinic, you'll get better care if you have something minor. At a hospital, you'll get better care if you have something major. All right, so about 98% of the time, people go to clinics because about 98% of the time, it's a minor issue, right? Things like a fever, you fall down and hurt yourself, you're a little bit dizzy, or you have a headache, or you have a sore throat, things like this, we'd go to a clinic. Something a little bit more major, heart attack, you get an axe through the head, a zombie bites you, something like that, we would go to a hospital, okay? Drive your car off a cliff. All right, so this is your GuardMe health card again, but this is the flip side of it. So you'll notice that on the back, we have a couple of phone numbers. The first phone number is a toll-free number, and this is good anywhere in North America. The second number is a local number, and you can call this number locally, or you can call it collect from anywhere in the world. So you should never, ever have to pay for a phone call to GuardMe. There's one major reason, a couple of reasons you may want to call. You may want to call to find out if you're eligible for treatment for something, but you should always call if you're going to be hospitalized, okay? Or if you've been recommended for expensive diagnostic testing, like a CAT scan or an MRI. The main reason for that you'll be interested in is that CAT scans, MRIs, hospital stays are incredibly expensive. So if you're eligible for that treatment, whatever it is, then our finance department can connect with the hospital or lab finance department, and we can arrange for the bill to be taken care of if it's eligible. Okay, does that make sense? So always contact us before you're hospitalized if possible, or as soon as possible after, or if you're recommended for expensive diagnostic testing. Okay, make sense? You guys are awesome. Any questions about that? Yeah.
Do you have, when you come to this GuardMe for policy, is it a list of clinics or hospitals that you can only go to, or is it any clinic that you can walk into? And
that's a great question. I'm actually going to cover that really soon. But we do have direct billing clinics that you can go to, but you can go anywhere you like. All right. If it's for a minor issue, you can go to any clinic. Any clinic. We do have direct billing clinics in Canada that make it a lot more convenient for you to visit a clinic. So I'll go over that in a couple of minutes. Thanks for that question. All right, this is a hospital waiting area. And this is actually not just a crazy picture. This is what they look like sometimes. If you go with a minor issue, you're going to be waiting a very, very long time. So this is one of the problems with going to the hospital with a minor health issue. We do something called triaging, which means that they prioritize your condition. And if you go with a cold, you could wait 8 hours, you could wait 10 hours. Somebody in Nova Scotia once waited 17 hours. This is true. I don't know why you would wait 17 hours with a cold, but she apparently did. And I think that's the record. That's the record that I've heard of anyway. If you go with something more major, you'll be taken, it will be highly prioritized and you'll be taken first. Again, if you go with a cold, let's say you're number 75 on the list, somebody comes in who's had a heart attack, now you're number 76. Okay, so it can keep going like that. So always a good idea not to visit the hospital unless you have a major, major issue. Let me ask you a question. If you had a really bad cold, really bad, very sore throat, didn't even want to speak, and your nose was completely stuffed up, really bad cold, where would you go? Clinic or a hospital? You guys are awesome. Yes, a clinic. Usually I get 1 or 2 people that say a hospital. Nobody said that this time. Congratulations. Good stuff. So we have local direct billing clinics, and you can find a clinic by going to www.guard.me, and you would click on clinics, find a clinic, okay? In the clinic search box, the province, which province are we in right now? Ontario, great. But you can search for clinics all across Canada, depending on which province you're in. And which city are we in? Toronto, everybody knows that, that's good. And then a list of direct billing clinics will come up. We also have, on this page, we also have a list of phone numbers that you can call to give you advice about which clinic to go to or which hospital to go to, if you like. So on this clinic search page, you'll find those phone numbers for whichever province you're in. These are some direct billing clinics in Ontario. I'm sorry, in Toronto. Apple Tree clinics are wonderful clinics. I actually use Apple Tree Clinic as my primary care clinic. I don't have a family physician. Yeah.
So what is direct billing clinic actually?
Say again, sorry?
Or what is direct billing clinic actually?
Good question. What is a direct billing clinic? So a direct billing clinic is a clinic that you can go to and not pay any money up front as long as you're going for an eligible treatment, right? If you go to a plastic surgery clinic and you want your nose, I would love a different nose, not possible.
So in a way, you can kind of use your health card as a credit card to go and pay for it. Services that it's covered.
Yeah, nice analogy, sure, yeah. You can show your GuardMe ID card.
Okay.
And as long as the treatment is eligible, so for example, you're not going to get a consultation on plastic surgery or something, that wouldn't be eligible for coverage. As long as it's eligible, you'll be treated and they will bill us directly.
Okay.
So, yeah.
No money up front.
No money up front. Sorry, I didn't hear that.
Sorry. If I cut my finger and I go to these clinics, then I don't have to pay for the emergency solution.
That's right. That's right. Yeah. So you can go, show them your card. It's always important to bring your card with you. Okay. So always keep it in your wallet or your purse. Show it to them, and then they will see you. They will treat you. They'll give you, whatever needs to be done. They will bill us directly, so you don't even have to make a claim after the visit. And Apple Tree clinics are wonderful. If you find a clinic that you feel that you want to go to click on the link. Actually, I can't show you the arrow here, but let's say you want to go to this one. Click on it, and you'll be brought to the Apple Tree site, and it will show you up to the minute wait times. So it'll show you how long you'll be expected to wait, or you can expect to wait, okay, before you see it.
What about a general medical checkup, like on regular basis, if I want to do a medical checkup?
Okay, that's a great question. So just, you're not having any symptoms. The question was, what if you want to just have a medical checkup? Under this policy, you're covered for one annual physician's visit, and that's up to $150 of coverage for the visit and any associated testing that might be done, okay? So usually it's an emergency medical policy. You need to have something that you're being treated for, but under this policy, you also have one annual physician's visit. So you don't need to be symptomatic for that. If you want to get your prostate checked, you can ask the doctor to check your prostate. Females may want to go for a pap test or something like that.
Just in addition to this question, what if the cost comes above 150? So you said it's covered to $150.
Yeah, so great question. If the cost of the visit is above $150, you're covered up to $150, right? So as long as it's eligible for coverage, then we would cover up to that amount, right? So we would cover, let's say it's entirely eligible for coverage, then we would cover $150, and then you would be responsible for the rest. Okay. It should be said too that annual physician's visits you will have to pay up front for. So they're not, even if you go to a direct billing clinic, they will not directly bill one of those visits. Okay. But you can always claim for reimbursement for those. So when you go to a clinic or a hospital, wherever you need to go, what do you bring? You bring a GuardMe ID card with you, and if you're not going to a direct billing clinic, bring enough money to pay for the visit. Okay? There's basically two ways to make a claim. As we mentioned before, you can go anywhere to any clinic you like. Afterwards, you'll want to claim for reimbursement. So two ways to make that claim for reimbursement. You can make the claim online by going to, does anybody remember the website? Awesome. Yes, just www.guard.me. Okay, so the ending is .me, not .com. And as long as the claim is under $1,000, you can do an online submission. Online is the fastest, easiest way to make your claim. These days, we turn it around in about 7 days. Within 7 days, so it could be faster. You can also make a mail submission. If it's over $1,000, you need to fill out a paper form and send it by mail. But if you prefer to send it by mail, if you prefer to fill out a form longhand, you can do it even if it's under $1,000. Who here prefers paper to electronic submissions? Doing it online? Nobody. That's totally expected. So online is the best way to do it, and most claims are under 1,000. Yeah.
What's the reimbursement time for mail? Still 70 days plus postage?
No, it really mail. We can't control how long it takes for it to get to us, or so.
Is it the same time?
It should be about the same time frame, but we don't give any sort of timeline just because we don't give any timeline just because we don't know how long it's going to take for the mail. But yeah, it should be about the same. Once we get it, yeah.
Does it matter what the cost is? If it's over 1,000, it's still 7 days once it's been received.
Okay, so this is for straightforward claims, right? If we need additional documentation, or if somebody's been hospitalized, for example, and it's an involved sort of complicated situation, then it could take more. If it's a car accident, something that everybody should know, if you're involved in a car accident, knock on wood, that doesn't happen either, but the car insurer, assuming that there is a car insurer involved, they would be considered primary payer. Okay, so they would need to pay their portion of the claim before GuardMe pays our portion. This is by legal precedent in Canada, right? So it's not just us, it's the standard across the industry. But it's important for us to know as soon as possible after your accident, because we can always help in some way, facilitate the process, right? So we can communicate with the car insurer, and sometimes we can make it a little bit easier for you. But we want to know as soon as possible after an accident, okay? Yeah?
Sorry, I got here late.
No problem.
We're talking about this is the interest that we're paying as an international student we get here. Right?
That's right, yeah. This is your international
benefits
student health
we
insurance.
get from that insurance. That's all the benefits, right?
Yeah.
Another question. If, after I finish college, right, there's a continuation that I can get or something like that?
So after you finish college, you can go to www.guard.me and you can purchase insurance from us directly. Unfortunately, you won't get, Centennial has arranged for a very, very good rate for you. Unfortunately, you won't get that discounted rate after graduation, but you can certainly apply for insurance through us. Yeah, yeah, good question, thank you. Okay, yes,
May I add a little bit?
sure.
Sorry, for hospitalization, when you guys are, let's say you have to be, maybe you're talking about hospitalization, right?
Yeah, yes. Go ahead, do you want to come in?
Yes.
With regards to certain cases where you have an emergency and you have to really go for a hospital, just make sure you have your card and make sure that what we can do is we can do a direct communication between the hospital and and GuardMe. However, you must inform GuardMe about the hospitalization. Have yourself, if you're able to do it, or someone with you, that to inform GuardMe claims department of the situation. You can call us also because we can connect with GuardMe. Just make sure that we are aware, or GuardMe is aware of the hospitalization, and so that sometimes it eases up the financial burden on your side. We can actually do a direct claim between the hospital and GuardMe. However, having said that, you also need to be able, you need to fill out a waiver form. That's why it's important for you to communicate with us, because we do have a couple of waiver forms that would allow GuardMe and ourselves, for that matter, to communicate with the hospital or vice versa, so that the claim can be processed accordingly. Okay, so please make sure if there's any emergencies, hospitalizations, to inform GuardMe claims department, which he has mentioned in the back of the card. The number is right there. Thank you.
Yeah, thanks, Donna. That's great. Thank you. That's important, you know. One other thing too about hospitals, if you go to a hospital emergency room, you will be asked to pay upfront, usually about $500 at least. If you don't have $500 on you, but you're there for medically necessary treatment, I'm not talking, you know, a minor cold or something. You're there and you need to be treated, you can always ask to be invoiced. In Canada, they cannot turn you away. Okay, so they can't turn you away. Ask to be invoiced. Does that make sense? Ask them to give you a bill. And then you would later claim for reimbursement and give us that invoice. Okay, does that make sense?
So that's your right.
That is your right. That is your right. Okay? Yeah.
So, one question.
Yes.
The emergency treatment is also covered by GuardMe?
Yes, emergency treatment is covered.
Okay. No matter what kind of emergency.
Can you clarify a little bit?
For example, that if I play basketball with my friends, I get injured really bad. I think my bone has been broken. I need X-ray. I need to check. This is one kind. And another kind, maybe suddenly I feel I cannot breathe. I feel something is wrong inside. I need to take X-ray to check of my check the room and everything. The
Sorry.
system.
Guys, can we not speak in the background, please?
Like want to check my breathing, the system, that I need another X-ray, that this kind of emergency is covered?
Yeah, so these, you've just described two emergency type situations that require medical treatment. So those are eligible for coverage.
I can just go to the hospital directly, or I have to.
You can call an ambulance if it's necessary, or somebody can call an ambulance on your behalf.
Okay.
You can go to an emergency room if you like, but for a very, very serious issue, if you're having problems breathing and you're losing consciousness, then you can call 911.
Okay.
Okay. Something I should mention though, because you asked if all emergencies are covered by GuardMe. Let's say you were drinking alcohol, and you were drinking a lot of alcohol. Drinking and drug usage are considered exclusions under the policy. And what that basically means is that, let's say you drink 10 beers. This is just an example, all right? But you drink 10 beers and you get up and start dancing on a table, just because that's what you do after 10 beers. And you fall off the table and you break your leg. It is highly likely that you would not be eligible for coverage. It would be considered an emergency, right? Or maybe you hit your head. Or maybe maybe you have something even more serious happens because of it. But it would be considered ineligible for coverage, not eligible for coverage, because alcohol is an exclusion under the policy, okay? If you're having one beer and you're walking down the street and a brick falls on your head, it's probable that it will be covered under the policy, right? It will be eligible for coverage because your drinking didn't contribute to the accident, okay? So I'm just giving you general situations. In the end, our claims department will always assess claims based on all of the evidence that they have, okay? But it's important to know about the alcohol exclusion. It's also important to know that if you injure yourself while committing a crime, I know everybody here is an upstanding citizen, you're not going to commit crimes, but if that were the case, it's a standard. It's an industry standard that you are not covered for insurance while you're committing a crime. For example, driving without a driver's license and you're in a car accident. The no car insurance company will cover you, obviously, because you don't have insurance, but you'll also be ineligible for coverage for any other insurance that you have as well. So it's just important, it's important to be aware of these things. Okay, does that make sense? Yeah.
What if you're a passenger and the driver doesn't have insurance and you get?
Okay, that's a great question. So if you're a passenger, not doing anything wrong, and the driver didn't have insurance and you get hurt, you would be able to claim under your GuardMe insurance, okay? The car insurer is probably not going to want to touch that, so you would be able to claim under your GuardMe insurance. I can't tell you right now if I can give you a general situation and say you'd be eligible for coverage, but if you were in the middle of robbing a bank, then you wouldn't be covered. Not that you would. But. Okay, does that make sense? Right. So the information that I'm giving you right now is very general information. We always need to assess a claim based on its unique characteristics in order to give an exact answer. Right? Oh, this right here is your paper claim form. So if you want to fill out a paper claim form and send it in by mail, this is the one that you would fill out. Or if your claim is over $1,000, this is the one you would fill out. Okay. Online, you would go to our website. What is it again? Good. Yes, good. So I always say the www, but everybody knows that anyway, right? So www.guard.me, and you would click on My Claim. That will bring you to a page like this. You'll need to put in your policy number. And where do you find your policy number? On the card, on the front of the card. And your date of birth. Everybody know the date of birth? Excellent. Yes, it's in your passport. If you forget. You'll be asked a series of questions just to make sure that you can make the online claim submission. It'll ask you if the claim is for under $1,000 or over $1,000, etc. If you're not sure how to make the claim, you can view our video tutorial. Okay, so just click on that. It's a very, very simple how-to. There's no spoken English. Music, nice, soothing music plays in the background, and it's not a long video, but it shows you step by step from the beginning how to make a claim. So we've had a lot of great feedback about that. And that's it for me. Are we hooked up to the internet right now? Yeah?
Yeah. Oh, yes, okay, yeah.
I don't think this link necessarily.
We have the total. We can use the, YouTube?
Oh, there it is.
Yeah.
Okay.
So do we have?
Welcome to your new room. I know you are excited about being in a new country and are ready to begin exploring, but remember, it's very important to always keep your gardening insurance card with you. If you ever get sick, or if you get injured and need to visit a doctor or a hospital, just show them your gardening card and you'll be well taken care of. Wait just 1 second. Remember to be careful when you're trying new activities. It's never fun to get injured, especially when you're away from home. If you're trying something for the first time, take it slow and don't try too much too soon. Remember that even though you are covered for new injuries and
reversing aspirate, but not the whole part of it.
Okay.
So can I claim 1 and 2 vaccinations regarding?
My understanding is that they'd be ineligible for coverage. You can always make a claim. You can always make a claim, right? But I don't think there's much point because they wouldn't be eligible for coverage. Yeah.
So you said one.
But you know what? If
up to $100 is.
Up to $100, but course required vaccinations. So yeah. So in that case, they wouldn't be covered. Okay.
Have you asked Pearl about it, about the reimbursement down the line? After, like you said, you will be reimbursed for a certain period?
No, certain amount, but it's more than that, so I'm asking that as they.
So that is the question that you raised to Pearl? Yeah. So I guess that's basically the answer.
Yeah.
It's going to be ineligible and it's on your pocket.
Yeah. It's a great program, though, which is Elpro. Are you excited?
It's very much.
Yeah.
Yeah, we're sending 200 students out.
It's amazing.
200, right? No?
It's amazing.
More
It's
than-
growing all the time.
Yeah, since 2011, we've sent 600
There you go. Yeah.
on just the
It's a good
Giselles.
experience.
Wow.
Where'd you say you're going?
Costa Rica.
Oh, good. What's the
So you're
project?
doing the turtle
It's
one?
rainforest.
Rainforest.
Rainforest. Wow, that's awesome. I wish I were young again. That'd be great.
So I just want to carry on with his question.
Sure.
Because I have similar one. I'm going to Spain, so in the same program.
Spain, yeah.
So, yeah, so there's a student health form we need to fill, and we need a family doctor to sign. And I think because we don't have a family doctor, maybe I will go to the apple tree. Maybe they will give a test to me, and will this be covered?
Now you can use that under your annual physician's visit. Okay, so you can be covered up to $150 for that.
Okay.
So that's what I would do. Apple Tree will not consider it a direct billing visit though, so you'll have to pay for the visit up front and then claim for reimbursement after. Okay? Does that make sense?
Can you repeat that? I'm sorry.
Sure, yes. So this gentleman's going to be going to Spain and he needs to have a form filled out by a doctor. So under your policy, this is an emergency healthcare policy. So usually it's for medically necessary, but you're eligible for one visit annually to a physician, and this would fall under that category. Okay. The only other thing is that if you go to a direct billing clinic, this isn't eligible for direct billing. So you'd have to pay for the visit up front and associated tests or whatever, and then claim for reimbursement. Okay.
Okay. Yeah. Sorry. I want to discuss another case.
Sure.
Actually, this is from a different company, different college.
Oh.
It happened to my girlfriend. My girlfriend is actually studying in George Brown, and she needed to have a health test in order to go to the placements. Then from the clinic, they found out maybe there is a small things on her lung, and that's required for the detailed testing. But it's okay because generally she passed the test, and the clinic strongly suggests her to go to the hospital. They already make a point for her, and they said the insurance will cover it. And then she didn't like to go because she thinks she's healthy. I encouraged her to go. Why not? Because the insurance is covering it. And after she went to the hospital, she received a mail with a bill that I'm sorry, but your insurance does not cover this kind of test.
Right.
So I'd like to know, is there any kind of list, what kind of test is eligible and what kind of test is not?
Well, I can answer that generally, and I don't know any real specifics about the case.
Okay.
Obviously, but if the hospital found that there was an issue that required medical intervention, then it's quite possible that it would have been considered eligible for treatment under the George Brown policy, right? I don't really know the George Brown policy, but it's quite probable that it would be eligible for treatment if it turned out that there was something. It probably wasn't eligible for treatment. It probably wasn't eligible for coverage because the tests turned up nothing.
Yeah.
And she was advised to go. She voluntarily went. She wasn't feeling bad. She wasn't really having symptoms, right?
Yeah.
So I think that's probably why it wasn't considered eligible for treatment, eligible for coverage. Does that make sense?
Yeah, I can understand a little bit, but if I need to go to some kind of similar test, how do I know if it's eligible or not? Is there any kind of
You can always, yeah, if you want to know, before you go, if you want to know whether it's eligible for coverage or not, you can always contact our claims department. So claims@guard.me, or you can call the number on the back of your card and ask to speak with the claims department. They can give you they can tell you what you need to know. They can tell you what documents you might need to supply them with in order, to give you an idea of whether it will be covered or not. but generally, and this is, and I'm speaking on a, in a general way here, if it's medically necessary, you'll probably go anyway and not worry about whether it's, whether it's eligible for coverage. And that's really the best barometer of whether it will be covered. Do you know what I mean?
Yeah.
So if it's medically necessary, go get it taken care of.
Yeah.
Does that make sense?
Yeah.
But you can always call our claims department if you have specific questions.
I have a question from online. Asks, how often do I get a new card? Every semester, every year?
Okay.
Or does my card last for my whole program?
Yeah, so this one goes from May to August
All our
31st,
cards,
correct?
all our cards actually end on August 31st. It's all the cards. So depending on your start date, if you start in September, then it starts from September 1st all the way to August 31st. Now, if you start in the winter, of course, it starts from January 1st until August 31st. And for those who just started their program this summer, it will be valid from May 1st to August 31st. Having said that, once you register again in September, then you will be covered for the whole year. So the end date is always the end of the school year, always, August 31st, yeah.
Now, is there
thank you.
expiry listed on the card that they can refer to?
Yes.
Yes.
The start date and the end date is actually on the card that you have, and just always refer to that, okay?
Yeah, thank you, yeah. So, and thanks for that question. And you will be getting a different card in September as well. So
Okay,
you'll have
the
a
other
different
question is,
policy
how do
number.
I get that card?
You'll get that in the same way through the international department. So it will be ordered for you. If you're a registered student, it will be ordered for you.
Okay, so this is how the card is. Sorry, Barb.
No, great.
Basically, all of you, the new entrants for this semester, you have received a direct email from Gardening. That's why we encourage you to go in there. You're given the policy number in there. You're given a special code that you can get into your policy, and make sure that you create your account. Because that way, if any way that you need the card, as long as you know your user ID and password, voila, you can get the policy number immediately. So please, please, first thing that you need to do right after this session is go on the Gardening website and create your account. You never know when you need a card. I mean, we would like you to always keep healthy, right? But in the event that it's after office hours, it's weekend, and you don't have access to us, it's good to have your account on.
Yeah.
Okay,
Oh,
so
can you get
do
it
that today. All of you receive a direct email from Gardening. So create your account immediately as soon as this session is over. Please, thank you.
So this is thank you, Donna.
They get an email, go create their account, and then they actually print out their own card.
Correct.
Now, English language learning students are getting a
The
physical.
actual card, yeah. The ELL students, which is no one is in here, they actually get an actual hard copy of the card. Yeah.
Okay. And this is the My Account feature. Okay.
So you don't want to wait
on the main
until you
webpage.
need that card and you're on the way to the walk-in clinic or hospital to go and create your account and print that out, right? So you guys need to do that now and then keep it in your wallet so that when you need it, you didn't expect that situation to come up, okay? So that's very important.
There was a question about graduation, after graduation, Bob.
Yes,
You know how to access it? Because right after graduation, you will not be covered after August 31st. Here, my code. This is where you go in and you will be able to log in, apply for an individual card after you graduate.
That's right.
For how long? The coverage after graduation.
After graduation, you can get a policy up to 365 days. Okay. So that's the length of, you can't get a policy that lasts 366 days, but up to 365. Okay.
Do we have any more questions?
The questions have been answered, so.
Oh, great. Okay.
I have a question because I think
Yes.
I'm the only girl, lady student. Well, I've been here a year and a half, right? So this is my second time with Garden.
With Garden
The
insurance,
first year,
great.
it was great, actually. I had emergency surgery, right? I had to go, and they cover everything. So
Good to hear.
it was a very good experience.
Way to go, Jeremy.
Unfortunately, I did have to go to surgery, but, now this year, I haven't had any checkups since my surgery, so I haven't had any physical because I didn't know that was covered. So I can go for to a regular, walking clinic for a physical checkup?
Yes.
Right? Annual physical checkup?
Yeah.
How about the, specialist ladies checkup, is that covered or?
You can, you can get those like general things done at the walk-in clinic.
And that is covered, but
And that's
prepaid
covered.
by me, right?
Prepaid by you, yeah. But you can get a pap test done there or.
Oh, okay.
Yeah.
Oh, okay, so we can do that on the walking?
Can I add a tip?
Yes.
Okay, when you're doing your medical once-a-year medical check and you're making a claim, please make sure that you put on the description side that you are availing of the once-a-year medical check.
Yes,
Because if
great
you
point.
don't do that, it will be denied. Okay, and also if there are denials on your claim, maybe you're just missing some information, documents that you need to resubmit. So read carefully what the instruction is, but it's always prudent to call claims department anyway,
Right.
and Mr. Bob.
And thank you. Something you should know too: if you need to go to a specialist, you go to a clinic first, and they would recommend you. They would refer you to an appropriate specialist. Okay, so this is the way it works in Canada. We need to go to a walk-in clinic first. Okay, we need to go to a general practitioner first, family physician.
My clinic. It's really very, very user-friendly. The whole thing is
My
very
clinic is
user-
for physicians.
for the physicians.
So we would go to clinics, find a clinic.
Kind of clinic for the walk.
Yes.
No, sure, you go ahead.
Do we need to print out the card or do we have to apply for the plastic card or something?
You need to print it out yourself. Yeah. So like Donna mentioned, you go to My Account, you set up an account for yourself, and you can print out the card.
That's all. That's all the printout I need. That's the one page I need.
That's all that you need. Yeah. That's all.
And
You can also get it virtually on your phone. I mean, you can upload it to your phone too.
Just always keep a copy.
So we can have a soft copy?
Eh?
Can we have a soft copy of that?
A soft copy on your phone, you mean? Yeah. 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 That's a great idea because then you've always got it with you. But I would also suggest having a paper copy in your wallet because, knock on wood, this doesn't happen, but if you pass out falling down and you fall on the street and nobody around knows you and somebody calls an ambulance, they're going to look in your wallet to see if you have coverage, right? So they probably won't check your phone for a card. So it's just a good idea.
Guys, sorry, I have one question. I had a couple of students coming in, and the problem was with their receipts. So doctor's office, they messed up with their names. So let's, for example, on the receipt it would say their middle name and their first name.
Right.
Let's say, for example, M and B, and so and so.
Right.
So that's the kind of receipts that they have, but they do have their first name there. Would it be okay to claim with that kind of a receipt, or to get it?
Well, if generally speaking, because sometimes our claims department may say, look, we need clarification on this, I would say if you notice that the receipt displays your name differently than your name actually appears on other documents or in your policy, it's a good idea to ask for it to be reissued with the proper name. Does that make sense?
Yeah.
Or is that answering the
like
question?
Previous couple of students, like one of the students, they went to a doctor that does not answer phone calls, like only communicates by email, and
Okay.
that too the response time is pretty long.
Right.
So she couldn't get a hold of the person who can reissue the receipt.
Right.
So she was a little worried, like what she should do.
Yeah, she can try to claim like that, but our claims team are fantastic. They really are. But sometimes they just can't accept a receipt, if it looks like the name is different. If it's
Right.
If it looks like it's very similar, but there was a typographical error, a typo, then maybe it will be accepted. I can only really give general advice here. I would suggest that if possible, always make sure that your name appears correct. If it's really difficult to get in touch with the person who reissues receipts, submit the claim and see what happens. Yeah.
Now, if you submit the claim and it's rejected, can you then go back to the doctor and say, I tried, this is not acceptable, can you reissue me the receipt, and then apply again, and then maybe?
Yeah, and it wouldn't be rejected on that basis. It would be, and I'm just being particular with words, but it wouldn't be rejected. It would be returned to you, and they would say, you know, we need a receipt that actually has your name. Go talk to the doctor.
So it's not.
So you wouldn't have to reopen. You wouldn't have to reopen the claim again. Yeah, that's a great question. Yes.
What is the upper limit of the claim?
The upper limit of the claim? Do you mean time-wise or money-wise?
Money-wise.
Okay, so your policy is up to $5 million, but certain benefits have their own coverage limit. Okay, so we talked before about paramedical claims, things like paramedical visits, things like chiropractic, acupuncture, massage therapy, chiropod visits, things like that. The upper limit on that is $500. All right, annual physician's visit, $150. Emergency dental, if you have pain and suffering and you're seeking immediate relief of that pain and suffering, that's up to $600. Okay, so things like that have their own upper limit, but hospitalization up to $5 million. All right, so you're well covered in the event that something extreme happens. Okay. Yeah.
So the policy also covers dental care as well, or?
So it covers emergency dental,
But not
up to $600. It doesn't cover the cost of cleaning. But what you can do if you want to have your teeth cleaned, U of T dental clinic or dental department does cleanings for Seneca students can go and get cleanings for I think $40 or so. Where else? Eh?
Centennial, buddy.
Say again?
He's in Seneca.
I need coffee. Sorry, Centennial. Seneca, we don't even work with Seneca, so I'm not sure why I said that. I used to teach at Seneca, I think that's why.
Okay.
Sorry. There's also Oxford College down the street. Oxford College down the street, we're actually working on establishing a relationship with them, and they're closer than U of T. So it may be possible to get cleanings done there for a similar price. In Canada, you can pay a lot of money for dental cleanings, so I would suggest going to U of T or Oxford.
Okay. For those people who came in late, we will go live again at 1:30, 2 o'clock in the afternoon, because we're now heading to Morningside.
I'm not going to broadcast that one. I'm not going to broadcast the one at Morningside, just this one.
Just this one? Oh, okay. All right. So I guess not, but
Yes.
So any more questions?
This is going to be available. This whole presentation will be available on YouTube. You can just check the International Facebook page if you want to rewatch anything. And then there's another session at Morningside today.
If you miss me, just go to YouTube.
Thank you so much.
Thanks a lot, guys.
We'd like to thank Bob for coming over.
Thank
Thanks.
you. Thank you.
Now and the document.
Yeah.
And the U of
Yeah, she can take a picture.